Right, so I'm going to hand over to Kat next, who's going to give us the view from Bristol, North Somerset and South Gloucestershire.
Now I will try and play with the screen sharing and hope it works.
Yeah.
I've only got one slide though, so technically I'm hoping it should be.
Yeah, no, so we were really mean and we had rules, which was only one slide.
Perfect.
Which I'm pleased to say that Louise, you kind of ignored, but that's fine because it was really interesting. But that's why Kat's got one slide, but I'm sure there'll be lots here that we can talk about.
So I would say what we've just heard from Lancs and South Cumbria has been really interesting and made lots of notes of stuff to learn from that, because I don't think we are quite as developed as they are. But we do have some stuff going on. I think the first and most exciting thing that we developed during when we first went into COVID and we had some COVID monies come through and what was going on, what we were expecting to happen, as you were saying earlier, with increases, we were expecting that increase in ED attendance, expecting that self-harm. So we set up very quickly with the help of Self-Injury Support Service, and Jess can tell you more about this later, is our ED referrals self-harm service. So this service was set up and established in December 2020, so quite quickly. And it is designed for people who are attending ED, having self-harmed, who are not known to secondary care services and not meeting the criteria to be referred to secondary care services. So it's all those people who attend ED and are discharged back to their GP with no support, for want of a better word, apart from being patched up and sent back out again. So the service is peer-led, and within 72 hours, they receive a call from the SIS service to book an appointment, which is then booked within a week. That appointment can be face-to-face, video or telephone, depending on circumstances where we are in COVID and what the service user needs. And that's then a one-off 1.5 hour appointment with one of the peer-led workers. And it's to talk about whatever the service user wants to talk about. So if their trigger for self-harm, it relates to debt, they can talk through debt worries, they can talk through wound care, they can talk through anything that is what they need to talk about at that moment around their self-harm. There's then a 2-week follow-up from that, which is like a 20 minutes, half an hour call just to see how they're doing, whether they've used any of the advice that's been used, and then a 3-month follow-up evaluation. And as we know, that doesn't get responded to as well as we'd all like. But we have we've just had the first annual report come through, which is amazing. We haven't had as many referrals into the service as we had expected, and I think there's some work going on to see why that is. And I think it's a lot of it's about the fact that potentially people going into ED are already known to secondary care services. So we are looking at whether there are more ED referrals coming in, but there's been, and I'm remembering this off the top of my head now, I think about 130 service users have been through the service since December. And again, this data needs to be validated, but we, on initial review, think only 3% of those have ended up back in ED since their initial referral, which is incredible. So we have recently agreed to extend the funding of this until March 2023. And we are expanding, we're working with the EDs to get more referrals in, but we're also looking to expand those referrals to walk-in centres, urgent treatment centres, and potentially also IAPT. So again, the people who ring IAPT but don't meet the threshold for IAPT services and would normally be referred straight back to GP with nothing. So potentially in there as well, and potentially other areas that we're growing it slowly so we don't swamp the service. We are absolutely aware that primary care and GPs is possibly one of those areas we want to expand it to eventually. The service would need to be a lot bigger than it is now to be able to cope with that. And it's one of the things that we're looking at through the Community and Mental Health Partnership framework work to grow that. And that's the reason the funding is till March 23, because hopefully it eventually will be part of that wider piece of work. So Jess can tell you more about that later on if we've got time. Other things that we've had going on. So in Bristol, we've had the Emergency Department Self-Harm Register for about 10 years or so, and it is got some amazing data in there. It has had intermittent funding that has been sort of 6 months and a year, and there's always this battle for ongoing funding for it. And also there's been a bit of a conversation recently about how it's used and whether it's collecting the right data in ways that is usable for services. So there's currently a options paper being drafted about the future of the ED self-harm register. So we're very much hoping that it will be able to be sustained going forwards, but also in a really usable fashion, potentially looking at some of that real-time work or ways of being able to tell us what's happening for some of those services going forward. So hopefully we will have some more information on that in the coming months. All three of our local authorities are in various stages of currently doing self-harm joint strategic needs assessments. So some are almost published and some are just gathering the data. So they're all in the process of that. So that will also tell us more about what's going on in our areas and where we've got services and gaps. And I know one of the really exciting things that I think South Gloucestershire have done or do on a regular basis is a online survey of all primary and secondary students. And they're currently analysing that data, but the initial data suggests approximately 25% of students have reported self-harm in the last year, which is huge information and will run through what happens next. So specifically looking at those children's and young people services, there's a lot of work currently ongoing to gather data, identify the needs and gaps in services. And I think that's where we are with our children's and young people services, is identifying that. However, I did have an email from them this morning, so I've slotted it in to say that there is some new BNSSG self-harm guidance for schools, which has now been adapted for non-school settings. And that is available on the Healthy Schools website for Bristol. So I can share that link if that'd be helpful. That's sort of an initial starting point. And then, as I say, we're sort of identifying needs and gaps. I think we are seeing, or initial data suggests we're seeing a lot more people coming through our children's ED. So just really identifying what's driving that, what that looks like and what we can do to support that. And I think all of those things that I've talked about, what big thing that they're doing is identifying the early gaps and what we need to do next. And the peer-led service has been really, really good at kind of identifying where they've got people coming to talk to them about certain things and whether they don't have the resources to be able to, that there's no sort of self-harm support groups in North Somerset that are meeting face-to-face at the moment. Some of them stopped because of COVID, some of the, so we're then talking to our North Somerset public health team about some funds they've got and whether we can direct those in the right direction. We've also identified that we need to increase our links with our LGBTQ plus disability and minority ethnic mutual aid groups, because they're areas that we don't have massive amount of support and information from, and also specific support for men that self-harm. I mean, obviously CIS's background is in supporting women, although the service they provide is all gender and 18 plus, that following on from that point, that there's not a huge amount for them to refer on to. So those are the ones that we've sort of identified as early gaps now. We meet, the BNSSG suicide and self-harm prevention group meets on a monthly basis, and we're setting up a rolling programme so that we talk about suicide prevention, children and young people and self-harm on a rotating basis, because I think it's been quite easy in the past for self-harm not to be one of those priorities. So we're making sure that at least on a quarterly basis, we're making sure that we progress where we are and know where we are